Thanks, Joe, and thanks for having me. So we're going to pivot to what I call first principles as we think about cardiometabolic, metabesity issues, and really going back to the fundamentals of how do you encourage, support individuals holistically in doing all the lifestyle and behavioral changes that we know from decades of data can make a real impact. And to the degree that we've been successful or unsuccessful, has been highlighted by a lot of the development efforts and the conversation thus far. But I'm going to tell you where digital health is going in terms of addressing this holistically. So not only from the lifestyle and behavioral perspective, but also over time how supporting people on that medication journey is also important. And we won't be able to dive into all the details. But this is a slide that you guys all know too well. Chronic conditions here in the U.S. Are an epidemic. Over half the U.S. population has at least one chronic condition. You see the top ones here, which are all either the direct derivative of obesity and metabolic derangements or comorbid along with them, and are a huge burden in terms of cost to the U.S. healthcare system. We know that the traditional care paradigm of going to your physician's office to get preventive care, supportive care, chronic condition care is broken. So 99% of the time, individuals are left alone to manage these conditions, typically with disconnected data that doesn't integrate back to their providers. Increasingly, the lack of a consumer-centric approach that is pervasive throughout the rest of their interactions, whether it be with technology or other service parts of their life. We know that we can't add any more burden to providers here in the U.S. There's a huge burnout problem, as many of you guys have probably read about or experienced. And then there's also lack of other support mechanisms that incorporate social determinants of health, all of which contribute to the poor outcomes that we currently see as it relates to metabolic disorders in this country. And so just to pivot for a second, the reason that digital health has come to the forefront and you're seeing so much activity in this space, not only from us, but from others, that's really exciting for me to see, is really born out of this continuum of the evolution of technology. So, back in the early 90s to the mid to late 90s, you had the real growth of the internet, which was really an information pathway and a connectivity pathway. You saw the rise of both mobile and cloud computing. With cloud computing, you had basically access to scalable, efficient infrastructure that was reliable, allowed that connectivity. And the mobile technology, pocketable computing, personalization, application of services, and really much more intimate connection with that information. And then more recently, you've seen the downsizing of biometrics and wearables. And so this has allowed not only a high frequency, but a high fidelity of information that can come back, connect to the cloud, and then be processed in a very meaningful and timely way. And so if you look at the landscape as it sits today in 2019, we sort of paved the groundwork for what is success in digital health today. And it really is based on the premise of connected technology. And so we've got a very strong thesis on cellular, and I won't go into why, but it basically creates a very frictionless consumer experience where you get data instantaneously, given the widespread of cellular connectivity and the ubiquity of cheap cellular chips. Second, with cloud computing, the ability to process that information very quickly in a real-time fashion that you can actually deliver back to a number of services in a very distinct and timely manner that is highly personalized, and I'll talk about that in a second. And then finally, what had been missing for a number of years as we talked about the rise of technology in healthcare is people forgot about the human touch. So I was part of a lot of this work early on that really touted the promise of technology for technology's sake, but what people really, at the end of the day, who are dealing with chronic conditions want is another human on their line to help them set goals, to support them, to actually help them when they're vulnerable as well. And this has become an important part of our platform as well as others to provide that timely support and do it in a scalable fashion that you can reach large groups of people when they need it, how they need it, in the convenience of their home. And so what we've really built out is a cardiometabolic suite of offerings that are all integrated. So as opposed to now having a single app to manage your diabetes or a separate app to deal with your hypertension or your weight management issues, we've combined those into a single experience with a single digital content, a single health coach that is going to track along with you with consistent messaging so that you're not bombarded every morning with 12 different messages from 12 different apps that tell you something conflicting as it relates to how to manage these comorbid conditions to help you improve your health. And so, and the last piece of it that we've started to double down on is actually behavioral science and personalization. And so we've shown now consistently with the fidelity of information we have, we can start to understand how people react to different messages, what they're interested in doing, and correspondingly send messages to them on a wide variety of surfaces to enable that behavior change that then we can track downstream outcomes. And then finally, all of this has to be aligned with value back to the health care system. And so one of the things that we have done that was unique in the industry is also build a subscription-based model. We know that chronic conditions, it's a journey. There's not, you don't graduate from having diabetes or obesity. It's a constant lifelong journey to providing real data on the outcomes that we're providing to the individuals, as well as economic savings back to the end client who's taking risk for the healthcare dollar. And those have been critical for the implementation of successful programs in this space. So that's a little bit of the journey, and happy to take questions to dive into when we have the time.
Thank you.